here for a cranial nerve examination? Yes? Alright, well, you picked the right place because this is the best specialist office for cranial nerves in the country. Yes, it's true, I promise. Well, you don't have anything to be worried about here. You are in capable hands, okay? So is this your first time, perchance? It is? Oh my goodness. Well, welcome. Alright, I can just explain to you what you're gonna experience. It's really simple, I promise, okay? So this office is filled to the brim with cranial nerve specialists, alright? There's 12 different cranial nerves. They're actually all right here listed. And we have 8 different specialists here. Just because some of them specialize in multiple nerves, you'll understand it later, okay? But don't worry, I promise that every single one of your cranial nerves will be tested, so we will ensure that we don't miss anything, okay? We'll make sure to go through each and every cranial nerve to make sure that your health is optimal, okay? So, all you have to do is there's a hallway located behind you, and you just have to go down that hallway and you'll see a series of doors, and they're all in a row, so you just enter the doors as you see them. So you'll go into the hallway, enter the first door, and you'll see a specialist. They're in there waiting for you, and they'll do the examination that they need to do for that specific nerve. And then when they're done, you can just leave that room and then continue down the hall to the next room. And then before you know it, you'll be done with all 8 rooms, and you'll be back up here to check out, okay? Alright, well, just be relaxed. You're in capable hands, like I said, alright? So just go to the hallway behind you and have a good time, okay? Alright, bye. Oh, come in. Hello, come in. Yes, you can come in and shut the door behind you, alright? Welcome into the first cranial nerve room, the olfactory nerve. I am the specialist for the olfactory nerve, and this exam is just going to be very quick, okay? Probably the quickest one out of any room. Yes, it's very short, okay? Because your olfactory nerve is just a sensory nerve that helps you smell. So all I have to do is test your smelling ability. Yes, so it'll be very quick, okay? So just sit down and relax, okay? If you don't mind, I just want to take a quick little peek around your nose first. Just kind of looking externally around your nose, seeing if there's any just lesions on the skin around the nose, and then taking a little peek inside, okay? So I'm just going to examine your nose really quick. I'm just going to touch around on your nose. You don't have to do anything, okay? You can just sit there, okay? Have you ever had any infections in your nose before? Okay, have you ever had any surgeries on your nose or any area around your nose before? Any procedures done? Okay. I'm gonna take this little microscope just to look inside of each nostril, okay? So could you just tilt your head back for me just slightly? Perfect, okay. I'm just gonna pull up on one nostril at a time. It's not gonna be uncomfortable at all, I promise, okay? Alright, thank you. So I'm just taking a quick look, okay? If you have any issues with your olfactory nerve, this could just cause your sensing ability to either completely disappear, or it could partially disappear, or it could become overly sensitive as well. That's a problem that can occur. Okay, I'm gonna look in your other nostril now. I didn't see any problems with that one, okay? I'm just gonna look in your other nostril. Okay. Also, sometimes people can have hallucinations, so they'll have a feeling that they're smelling a scent that's not actually there, which when I have you
test some scents in a second. We'll see if that's a problem, but have you noticed any changes in your smell recently? Okay. Is there any scents that you feel you're particularly sensitive to? Okay. Well, I didn't see any issues inside your nose or around your nose, which is great, okay? So what I'm going to do now, which is the last thing that we're going to have to do, is I have these scented beads, and I just have a few options, and I'm going to put my hand over your eyes, and I'm going to have you smell them, okay? So these are just common scents, so you should be able to recognize them, okay? It could just be things like what you see on the wall back here, so it could smell like peppermint, or apple, coffee, chocolate cake, pine, just common scents, okay? So you should be able to recognize them, alright? So I'm going to cover your eyes, alright? So just relax as I cover your eyes, okay? I'm just gonna put my hand over your eyes and I'm just gonna make sure you can't see out of anywhere in your eyes. Okay, your eyes are completely covered. Okay, perfect. Alright, so I'm just gonna take the lid off. I'm gonna take the lid off of this thing and I'm just gonna put it under your nose. Can you just sniff, 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 sniff? Perfect, perfect, perfect. Okay, okay. I'm just gonna put the lid back on. I'm gonna take my eyes off. Okay, what did you smell? Perfect. Yes, that was wonderful, okay? So I'm gonna take another one. And this time I'm going to cover one nostril. Okay, so I'm going to cover your eyes again. Okay, and I'm just going to check that you can't see any out of it anywhere. Okay, so I'm going to see what the scents say. Okay, can't look. Okay, perfect. I'm going to take the lid off of this. Okay, and I'm just going to put it under your nose. Can you just smell that really quick for me? Just smell it really quickly. Okay, make sure that you get the bud in your nostril. I have one nostril closed. So just seeing if this nostril works properly. Okay, did you get a good sniff? Okay, perfect. Take my gloves off. What did you smell? That's correct. Yes. Alright, perfect. Then I'm just gonna take one more and I'm gonna cover your other nostril. Okay, everything looks perfect so far, so I'm sure the other nostril will be fine, but let's just double check, okay? So I'm gonna cover your eyes again. Just one last time, okay? Just keep staying relaxed, okay? Just again, make sure that you can't see out of anywhere, any corners, okay? Make sure that it's accurately covered, okay? Perfect. I'm gonna take this, I'm gonna take the lid off. Okay, I'm gonna put this under your nose, okay? Can you just sniff, 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 just really quickly? This is just the last one. I'm gonna have one of your nostrils covered, okay? That's perfect. Just smell with this nostril, okay? Okay, did you get a good smell? Okay, perfect. I'm gonna put the lid back on. I'm gonna take this away from your nose, okay? I'm gonna take my gloves off. Okay. What did you smell with this last one? Wonderful. Yes, that was absolutely perfect. Okay, you got all three completely accurate, so both of your nostrils work. Okay, I don't see any problems with your olfactory nerve, okay? So you're done with your first room, okay? And you passed it wonderfully, so there's not any issues, okay? Alright, so I'm so happy that you came in here, okay? So all you have to do is just go back out the door and continue walking down the hallway and just walk straight down and you'll find the next cranial nerve room, okay? Alright, thank you for coming in here. Bye. Oh, come in, come in, come in. Hello, welcome. Come inside. Yes, come in, come in. You can sit down. Welcome to your second cranial nerve room. I specialize in the optic nerve, which is also the second cranial nerve, and your optic nerve deals with your eyes. So all of the tests that I'm going to do on you today are going to deal with your eyes, okay? Alright, so if you don't mind, I just want to quickly take a look at your eye, kind of pulling at the skin around your eye a little bit, just to examine with just my naked eye the surface of the eye and your eyelids and kind of underneath your eyelids and things, okay? I won't tug anywhere or be painful at all, I promise, okay? Alright, so you can just relax. some of the things that I'm going to be looking out for today are signs that can indicate to me that your optic nerve is damaged. So each of your eyes has an optic nerve that begins at the optic disc, and if your optic nerve is damaged in any way, it can cause vision loss in one or both of your eyes, and this vision loss can be partial vision loss, or it can be complete vision loss. It can also cause you to lose your color vision in one eye or both eyes. It can cause eye redness. It can cause abnormally sized pupils. It can also cause movement pain. So when you look up, look down, look side to side, when you blink, you could have pain. Have you ever experienced any eye pain recently, at least? Okay. It can also cause your eyes to be extremely sensitive to light. Have you ever had an eye surgery before? Okay, like LASIK, or do you have any known eye issues? Things like glaucoma can cause damage to your optic nerve because the high pressure or high fluid pressure that builds up in your eye can cause damage to the optic nerve, and there's other disorders as well that can cause your optic nerve to become inflamed or have restricted blood flow to your eye, or to your optic nerve, which can damage it. Alright, so my visual inspection looks okay. Alright, at any time during that inspection, was it painful, or did you experience any discomfort anywhere? Okay, perfect. Alright, so I'm gonna start by testing your color vision in both eyes, just to see if you have any color blindness, okay? So I'm gonna take this colorblind testing book, and I'm just going to have you look at some samples of color variations, and I want you to tell me what number you're able to read in the book. What number do you see? Perfect. Good job. Okay. I'm going to go to the next page, and it's just the same thing, this time with different colors, because there are different types of color blindness. Alright, good. Just a few more. Okay, can you read this one? What about this one? Can you read it? Can you make out what number is there? Alright. What about this one? Can you make out what number is on the page? Alright. And I think that there's just one more that you have to do. What about this one? Can you read what number is on the page? Wonderful. Okay. You passed the little testing booklet, so there's not any color blindness in either of your eyes. So I'm going to put that back up. as I mentioned earlier, another problem that can occur if your optic nerve is damaged in one or both eyes is it can cause a reduction in your visual field. So I'm going to test if you're experiencing anything like that. I'm going to take maybe this green one. Okay. I'm just going to test your visual field. Okay, so just to see if your peripheral vision has been reduced at all from what is considered normal. Okay, so you can just stare straight ahead. Alright, I want you to tell me when you can no longer see this green tip. Okay, so just tell me when you can no longer see it. Alright, that's good. Tell me when you can no longer see it. Okay, good. Tell me when you can no longer. Okay. Tell me when you can no longer see the green. Okay. I want you to cover one eye for me. Yes, just close one eye. Okay. I'm gonna see. Tell me when you can see the green tip come into your field of vision, okay? Okay. I'm gonna come over here. Okay. 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 Okay, you can open that eye. And can you close your other eye? Just one. Okay. Alright, I want you to tell me when you can see it. Okay. 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 Alright, perfect. You can open your eyes again. Okay. I didn't see any problems with your visual field, so you can rest assured that everything is perfectly okay with your color blindness, and well, which you don't have any, but your color vision is perfectly okay, and your visual field is perfectly okay. Alright? Alright, so now I'm going to check your visual reflexes, okay? So I'm going to take this light. Alright, so I'm gonna just start by checking your pupil size and shape in both eyes, okay? So I'm looking to see if there's no abnormal sizing, because a damaged optic nerve can cause abnormally shaped pupils. It can also cause your pupils to not have similar sizing. Your both pupils, they can be slightly off, but they should be around the same size for both of them, okay? I'm gonna use this to look and see what yours is. Maybe like 3 or 4 millimeters. Both of your pupils look fine to me, and according to the size chart, they are in perfect size, okay? It's average, so you don't have to worry about that, okay? So I'm just going to check your pupillary response, which can be off if your optic nerve is damaged, okay? So I'm just gonna check. Okay, I'm just checking your direct response and your consensual response for each eye. Okay. Okay, just making sure that I don't ever miss. Okay. I'm gonna go to your other. Okay. If your optic nerve is working correctly, then your pupil will shrink when bright light is applied in order to let less light come into your eye, and when it is darker, your pupil grows larger to let more light into your eye. So when I'm applying this light, your pupil should shrink, and then when I take the light away, it should grow bigger, which I'm seeing it do. Okay, I'm gonna apply the light in this eye, and I'm gonna look at what your other eye does. So I'm looking for the consensual response now. So even if the light is shined in one eye, your other pupil will have a response as well. Okay, I'm gonna do it in the other eye again. I'm gonna look at this eye. Okay. I didn't see any problems. Okay, so I'm gonna put this up. Okay, so now I'm going to take my ophthalmoscope and I'm gonna do a fundoscopy exam on your eyes. Okay. I'm gonna take this and I'm gonna start. You can just stare straight ahead and relax your eyes, okay? And during this fundoscopy exam, you can blink anytime that you need to, okay? So I'm gonna start a little far away. Oops, sorry. I'm gonna start a little far away and I'm going to look at the surface of your eye. Okay, so just, I'm gonna do without the light first. Just looking at both, just looking at the surface of the eye. Okay. Alright, I'm gonna get really close. There's gonna be a light. It's not terribly bright. And I'm going to just get really close, okay? I'm going to be looking at the interior segment of your eye. You can just keep staring straight ahead and you can blink whenever you need to, okay? But I'm just looking at your cornea, your iris, and your lens, okay? Just making sure that I don't see any problems, okay? Alright, I'm gonna go look at your other eye. Just keep staring straight ahead. I have to get very close, okay? I'm just looking at your interior segment again for this eye. Okay, I'm just looking at the cornea of this eye, the iris of this eye, the lens of this eye. Problems, okay. Alright. Okay, so now I'm going to take some eye drops and put them in your eye. This is just to dilate your pupils so that I can now look in the back of your eye. It's not going to hurt at all and it'll be immediate, so we don't have to wait for your pupils to dilate. We'll just do it immediately, okay? Alright, so can you just look up for me? Thank you. I'm just putting this in your eye. Okay. Blink, 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 blink. Okay. Okay, I'm gonna look up again. I'm gonna do it in the other eye. Okay, I'm gonna do it right there. Okay. Blink, 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 blink. Okay. Alright. Let it settle in both of your eyes. Okay, wasn't painful at all, right? Okay, perfect. Good. Alright, I think I can continue. So I'm gonna get really close again, okay? And I'm gonna just stare straight ahead, okay? I'm gonna put my hand on your shoulder just to make sure I don't bump into you at all. Okay. So I'm just going to get really close to you again so that I can examine the back of your eye. So I'm just going to start by identifying one of your retina blood vessels, and I'm going to follow this blood vessel all the way back to your optic disc, and I'm going to assess the optic disc going to go to your other eye. Remember, you can blink anytime you want, okay? Alright, so I'm gonna just do the same thing, okay? So I'm gonna get really close to your eye again, and I'm going to, again, start by identifying one of your retina blood vessels, and I'm going to follow this blood vessel all the way back to your optic disc. I'm going to assess the optic disc. Okay, I think all that looks healthy. Alright, now I'm going to go back and I'm going to assess all the rest of your retina blood vessels. Make sure that they're all healthy. Okay, can you look directly at the light for me? Thank you. I'm just looking at your macula and making sure that it looks okay. Alright. Can you look straight ahead again? Just double checking everything. Okay, I think everything looks healthy. I don't see any issues with this eye. Okay, just checking. Okay, good. I'm gonna take that away. Okay, so the last thing that I need to do is I need to just see if there's any problems with your vision, okay? So you've passed all the tests that we've done so far, which is great, okay? So there's just this one last thing to do and then you'll be done in this room, okay? So do you currently have a prescription for your eyes, whether it be a contact lens prescription or a glasses prescription? Okay, is it that number in both eyes, or is one eye different from the other? Okay, so what I'm gonna have you do is I'm gonna have you just quickly turn and face this other wall where I have the eye chart, and I'm going to take the prescription that you said you have, and I'm gonna place it and see if your prescription works, okay? It'll be really quick, I promise. Alright, so just quickly turn and look over here for me, okay? Okay, so now that I have you facing the other side of this wall, I'm going to get a lens from my collection of lenses that matches the prescription you told me. Let's see, how about this one? Okay. This one works. Okay. So I'm just going to put the lens in front of your eyes, and I want you to just tell me which line you can read. Okay, closest to the bottom. Alright, so I'm going to take this lens, okay, and I'm going to just place it over your eye. I'm going to situate it comfortably. Okay. Okay, it doesn't hurt anywhere. Okay. Can you read to me the farthest line down that you can read? Okay. Alright, and can you see the two colors on the chart? Okay, perfect. I'm going to take that off. Now I'm going to just put it on one eye at a time. So I'm going to put it on this eye first. I'm going to slide it onto your eye. Okay. Alright. So make sure that your other eye is closed, okay? What's the furthest line down that you can read? Okay. Okay. Alright, perfect. I'll take that off. Okay. That all looked good, so I'm going to go to your other eye now, okay? So I'm just going to slide this onto your other eye. Okay. Alright, is that on your eye comfortably? Doesn't hurt anywhere on your skin? Okay. Then what's the furthest line down that you can read? And can you see the two colors? And tell me what they are. Alright, perfect. Okay, I'm gonna take this off. Okay. I'm gonna put the lens back on your other eye just real quickly because I realized that I didn't ask you to tell me the colors for the other eye, so I have to do that again really quick, okay? Sorry. It'll just be really quick, I promise, alright? So I'm gonna put the lens back on your other eye really quickly, okay? Is that comfortable? Okay. Just tell me what the two colors are. Can you see them with this eye well? Make sure your other eye is closed. Alright, good. Take that off again. Okay, let me put this lens back on my shelf over here. Alright, so everything looked fine with your visual test. I think that your prescription is fine. So I'm going to have you turn back around to the other side, okay? Alright, so everything looks perfectly fine with your optic nerve. I didn't see any issues, not just in one eye, but in both eyes. So your optic nerve for both eyes looks absolutely wonderful, okay? You have nothing to be concerned about with it, alright? So you're done in this room, so you can just go back out the doors and continue down the hall, and you can go to the next room, okay? Alright, well, thank you so much for coming in here, okay? Bye! Oh, please come in. Hi! Hello, welcome. Come inside, sit down. You can sit in this chair right here, okay? Just sit, relaxed, and comfortable, alright? So welcome to your third cranial nerve room. And in your third cranial nerve room, I actually specialize in 3 different cranial nerves compared to just one. So technically I'm a little bit smarter than the other ladies, but don't tell them I said that, okay? I trust you, okay? So the 3 that I specialize in compared to one like the rest of them are the oculomotor nerve, the trochlear nerve, and the abducens nerve. So cranial nerves number 3, 4, and 6, okay? So the reason that I specialize in 3 cranial nerves is because all 3 of these cranial nerves work together to make sure that you have proper eye movement, okay? So if you don't mind, I'm just gonna start kind of looking around your eye, at your eyelid, and kind of assessing your pupils and just your natural gaze and eye movement, okay? So you can just sit as you normally do and keep your gaze as you normally do, blink as you feel comfortable, okay? So you have 6 extraocular muscles that help ensure proper eye movement. Your oculomotor nerve supplies 4 of these extraocular muscles. The trochlear nerve supplies the 5th extraocular muscle, and your abducens nerve supplies the 6th extraocular muscle. So it helps your eyes be able to look up, down, sideways, inward, all around, so that you're able to adequately look around your field of vision, okay? So things that I'm going to be looking out for are things such as drooping of your eyelid, which I don't see anything like that so far. Have you ever had muscle spasms in your eyelid? Okay. I'm also going to be looking for cross-eyed, any eye that may be drooping to one side or both eyes that drift off. Issues with any of these cranial nerves can also show up with double vision or abnormally large pupil size. Can also cause you to not properly respond to light, so have a non-reactive pupillary response, but I won't have to test that because the optic nerve specialist told me that your pupillary response was perfectly fine, okay? So I won't have to test that part. But what I'm gonna do after I finish just doing a visual examination of your eyes, could you look up for me really quick? Thank you. Is there's 6 different eye movements that I'm going to be testing. Could you look it down for me? Thank you. And I'm going to be having you go through each of these 6 eye movements just to make sure that your eye movement is functioning properly. Could you look to the side? Thank you. Make sure that you have simultaneous movement of the pupils in both eyes, that not one eye straying. There's not any weakness showing up in the extraocular muscles that would show a problem. Could you look to the other side? That could show a problem with any of these 3 cranial nerves that I'm testing. Okay. I didn't see any issues there, just looking at your eyes visually, okay? So I'm going to start testing the 6 different eye movements. So the first one that I'm going to test is your accommodation reflex. So I'm going to take this colored end of a Q-tip, and I'm going to have you look at it as it's close up to your face, okay? And I want you to stare directly at it, and then I want you to keep staring at it as I move it farther away, okay? So your accommodation reflex is just your eye's ability to continue focusing on an object that is moving throughout your field of vision, different distances to your eye. So I'm checking to make sure that your lens change their size accordingly and that your pupils change their size accordingly. Have you seen any double vision so far? Okay, are you having any troubles focusing on this as it moves close up and far away in your vision? Okay, I'm just gonna do one more. I don't see any problems. Your eyes, from what I can tell, seem to be accommodating just fine. Okay. So what I'm gonna do now is you passed the first one, so good job, okay? So there's just 5 more eye movements that I'm going to test on your eyes. So the next one is the optokinetic response. So I'm going to have you look at the blue tip of the Q-tip, and I'm going to have you continue to stare at it, and I want you to follow it until it goes out of your field of vision. And once it has been removed from your field of vision, I want you to return your gaze to center, okay? So keep your head straight, okay? You can keep your posture relaxed and everything, alright? So look at the Q-tip. Okay, keep staring, keep staring, keep staring, keep staring. Okay, return your gaze to center. Perfect. Okay, look at the Q-tip. Keep looking, keep looking, keep looking, keep looking. Okay, center gaze. Perfect. Okay, I'm gonna go up this time. So look at the Q-tip. Keep looking, keep looking, keep looking. Return to center. Perfect. Okay, I'm gonna go do this side now. Okay, look at the Q-tip. Okay, look directly at it. Have it come into focus. Okay, keep looking, keep looking, keep looking. Okay, return to center. Wonderful. Okay. So that all was good. So you passed the second eye movement test, okay? Alright, so I'm going to move on to the third eye movement test, which is saccades. So I'm going to check to make sure that you can properly do the saccades eye movement, okay? So I'm going to take 2 colored Q-tips, and I'm going to have both of them in your field of vision, and I want you to look from one to the other. Okay, so look from the blue to the purple, alright? Slowly looking from one to the other. Blue to purple, blue to purple. Alright, so now I want you to do it as fast as you can from blue to purple. Blue to purple. Okay. I'm going to put it vertically in your field of vision, okay? So just slowly look from one to the other. Alright, I'm checking that your eyes are able to look and focus on two different objects. Can you do it rapidly now? Thank you. That are in your field of vision, just to ensure that you are able to do rapid eye movement in a smooth manner, and both eyes do it simultaneously. Okay, I'm gonna have it diagonally. Okay, I'm gonna have it a little up close. Okay, look from one to the other slowly. I'm just looking very closely at your eyes as you do this, checking that the pupil size is fine, that both of your eyes are moving simultaneously with one another. Could you do it fast now? Thank you. Making sure that the muscle seems strong and that your eyes don't see any problems with the movement. Okay. I'm gonna have it this way, diagonally. Can you look from one to the other slowly? From blue to purple, purple to blue, blue to purple. Just looking closely, examining both eyes. Okay, could you look rapidly between the two? Thank you. Blue to purple, purple to blue, blue to purple, purple to blue. Okay. Wonderful. You passed the saccades eye movement test, okay? So next, I'm going to take the blue one again, and I'm going to test your smooth pursuit eye movement, okay? So this one's very easy, alright? I'm sure you'll pass it just like you passed the other ones, okay? So you're just going to look at the blue Q-tip, and you're just going to follow the blue Q-tip as it moves across your field of vision, okay? So just keep your head straight and just look at it as it moves around your vision, okay? So just look at it as it moves. I'm just looking to make sure that both of your eyes can do proper eye movements of depression and elevation and abducens and adduction. Okay. Did I just say abducens? I think I did. I take that back. I meant to say adduction, not abducens. That's the cranial nerve. Forgive me, okay? I swear I'm a specialist. Oh yeah, swear. I'm checking to make sure that your eyes can properly adduct and abduct. Okay, not abduce. That's the cranial nerve. Alright. But if they can properly abduct and adduct, then your abducens nerve probably works fine. Okay. Keep following it. I'm just checking the eye movement of both eyes. Okay, I'm going to bring it a little bit closer, just a little bit. Just look up and with the blue. Okay. I think that all of that looks fine, alright. I didn't see any problems with either eye, okay? So next, I'm going to test your vestibulocochlear response, okay? So I'm going to have you, I can actually put both of these Q-tips up, okay? So I'm going to have you stare straight ahead at me, and I want you to, keeping your gaze straight and center, I want you to move your head to one side, okay? So just keep your head straight first with your gaze straight, and then keeping your gaze on me, move your head to this side. Okay, I'm just making sure that your eyes. Okay, making Could you move it back to center slowly and then move it back out one more time? I'm just closely looking at both of your eyes to make sure that they move properly and they're able to accommodate for changes in the position of your head, but being able to keep it stable. Okay. So bring your head back to center. Okay. Now I want you to do the same thing, but move it to the other side. So keep your gaze on me. Alright, now turn your head to this side. Okay, and as you do that, I'm just going to look closely and make sure that your eyes both move properly, that they're able to stay steady and strong, staring straight ahead as your head moves. Okay, move your head back to center. Alright, and then I want you to just do it one more time. Alright, again, just checking that it looks fine. I think all of it looks fine. It looked fine with the other ones, I'm sure. Their eyes seem steady and strong. Okay. Now, bring your head back to center. Okay. I want you to just do it back and forth. So keep your head gaze straight and then just go back and forth gently, okay? Alright, back and forth, back and forth. Okay. Just making sure that your vestibulocochlear response is fine. Okay. Alright. You can bring your head back to center and relax, okay? Everything looks fine, okay? So you passed the 5th eye movement test, alright? So good job, alright? So there's just one more, and then you'll be done with this room, okay? So the last one is the easiest. I'm gonna take, how about I do purple this time, okay? The last one is just visual fixation. So I'm just going to have the Q-tip at a singular position in your visual field, and I want you to just stare at it, and then I'll eventually move it to another position, and I want you to change the center of your gaze to that new singular position, okay? So I'm gonna put this right here, okay? I want you to stare directly at the tip of the Q-tip, the purple Q-tip. Just stare straight at it, okay? 3, 2, 1. Okay, I'm gonna move it to a different position. Okay, I'm just making sure that both of your eyes are being able to stay in the same position and are strong and steady. Okay, 3, 2, 1. Okay, I'm gonna move it over up here. Okay, this part of your visual field. Just keep staring. I'm sure my hand moves a little bit. I apologize. I can't keep it perfectly straight across, but I do my best to stare straight at it. Okay, you're doing great. 3, 2, 1. Okay. I'm gonna go right here. Okay, stare straight at the purple Q-tip, the tip of the purple Q-tip. Just stare straight at it. Okay, you have a steady gaze. That looks wonderful. 3, 2, 1. Okay, I'm just gonna do one more, okay? I'm gonna have it right there. Just stare straight at the tip of the Q-tip, looking at both of your eyes. Okay. 3, 2, 1. Okay. Perfect. Gonna put that up. Alright, so I tested all 6 of the eye movements, and you passed every single one, okay? So I can officially say that your oculomotor nerve, your trochlear nerve, and your abducens nerve work perfectly fine, okay? There's no problems. Alright, so you're done with this room, so you can just go on back out the door and go down the hallway, and you'll find the next room, which is cranial nerve number 5, the trigeminal nerve, okay? Alright, I hope that you enjoy it, okay? I loved having you in here, alright? Bye-bye. Oh, you can open the door, you can open the door. Hi, come on in to my room. Welcome to the trigeminal nerve room. I'm the specialist for the trigeminal nerve. So just sit comfortably, alright? I'm gonna focus mainly on sensations of your face, okay? So the trigeminal nerve has both sensory and motor functions, okay? So it has 3 branches: the ophthalmic branch, the maxillary branch, and the mandibular branch. So I'm going to be testing all 3 branches, and the sensory component of the trigeminal nerve allows you to feel sensations all over your face. So like being able to feel when I touch your face, being able to feel changes in temperature on your face, or being able to feel any pain on your face, okay? So I'm going to start by testing the sensory component of your trigeminal nerve and making sure that each division works correctly, okay? Alright, so I'm going to start with just a really quick little test with some ice. So I'm going to check if your skin, you can feel any temperature changes on your skin, okay? So this ice doesn't burn at all if I just put it on my face. See, it feels fine. So I'm just going to quickly dab it, just a little bit, put that right there, on just a few areas of your face, okay? And I want you to tell me if you can feel it. Okay, so I'm just going to put it up here first, right there. Did you feel that? Perfect. Okay, I'm gonna go down here to like your side of your nose. Did you feel that? Perfect. Okay, I'm gonna go down to your chin area. Did you feel that one? Perfect. I'm gonna do one over here on your cheek. Alright, I'm gonna do one on your other cheek. Perfect. Okay. That's all we're gonna do with the ice, because I know it is quite cold and dripping. So I'm gonna put the ice back in the ice container. Okay. So I didn't see any problems with feeling temperature changes on your skin, so that works great, okay? So now I'm going to take a soft cotton swab, and I'm just going to dab it a little bit on different areas of your face, and when I say tap, I want you to tell me if you can feel it, okay? Alright, so did you feel that one? Okay, just say yes whenever you feel it. Okay, I'm just going through. Okay, I'm going here on the side of your nose. Alright, I'm gonna go on top of your nose. That's perfect. Okay, I'm gonna go in between your eyes. Alright, I'm gonna go up on this side of your forehead. That's perfect. I'm gonna go over here on this side of your forehead. Okay, perfect. It's great. You're feeling it perfectly so far. Okay, I'm gonna go to this cheek just to do a big circle on this cheek. Do you feel it? Okay, perfect. That's wonderful that you feel it. Okay, I'm gonna go to this cheek. Make sure that you can feel it over here. Okay, perfect. I'm gonna go above your top lip. Above your top lip. Can you feel this? Feel this? Okay, perfect. I'm gonna go on the top area of your chin, so like right below your bottom lip. Do you feel this? Okay, perfect. I'm gonna go on your chin. Okay, I'm gonna go to the side of your jaw area. Do you feel that? Okay, perfect. I'm gonna go over here. Feel this. Okay, perfect. Can you close your eyes for me? Okay, I'm gonna do one on both of your eyelids. So just, do you feel this with your eyes closed? Perfect. Okay, I'm gonna go to your other eyelid. Do you feel this with your eyes closed? Perfect. Okay, you can open your eyes again, alright? So I didn't see any issues with this test, okay? So I'm gonna put this down here to get rid of when we're done, okay? So I'm gonna take a sharp tip this time, but it's not painful. So, but you'll just feel a little prick, but not painful at all, I promise, okay? So I'm going to just apply this on different areas of your face, different areas of each branch to make sure that each branch is working correctly, okay? Alright, so I'm gonna start up at your forehead, okay? So just keep your face still. Did you feel that? Okay. Okay. Just checking all the areas of your forehead, okay? I'm gonna go in between. Okay, can you close your eyes again? Thank you. I'm gonna do this eye. Okay, I'm gonna do that eye. Alright, I'm gonna go atop your nose. Okay, I'm gonna go to the side of your nose. I'm gonna go to this side of your nose. I'm gonna go below your nose above your lip. Alright, I'm gonna go below the lip. Okay, I'm gonna go farther down the chin. I'm gonna go to the side of your mouth. I'm gonna go to this side of your mouth. Okay, you're doing great so far. Alright, I'm gonna do this cheek. Alright, I'm gonna do this cheek over here. I'm gonna do a different spot. This spot. That spot. Okay. Alright. I'm going to dispose of that tip at the end. So, all of your sensations worked absolutely wonderfully, which is great. So you have nothing to worry about that. Your ophthalmic division, I didn't see any issues with your ability to feel changes in temperature, the cotton swab, so just feelings of touch, or the sharp tip, so little feelings of pain. And similarly, I didn't see any issues in the more middle area of your face with the maxillary division, and then the bottom of your face with the mandibular division. I didn't see any issues as well, okay? So another thing that I'm going to test really quick is I'm going to take another soft tip cotton swab, and I'm going to check your involuntary blinking response, okay? So I'm going to go to the side of your eye, and I'm just going to lightly place this on your eyeball. It won't hurt, I promise. I swear it's not gonna hurt, okay? So you don't have to worry about that. You can just continue to be comfortable, okay? But I'm just gonna slightly place it on your eye and see if your involuntary blinking response works perfectly well, okay? So I'm gonna just stare straight ahead, okay? I'm gonna come over here on this side and I'm just keep your eye open. I'm just gonna slightly place it, okay? I'm just gonna check that you blink perfectly. This isn't painful at all, I promise, okay? Blink. Alright, perfect. That looked great, okay? I'm gonna go to the other eye now. So just keep staring straight ahead. Okay, I'm gonna get really close to your eye, and again, just keep staring straight ahead. I'm just gonna be placing it right on your eye to check your blinking response. Make sure that everything works perfectly. Okay, blink. It's not painful. Okay, just relax. Okay. Perfect. Alright. I didn't see any problems with your blinking response, so that's all good, okay? So now what I'm going to do is I'm going to have you open your mouth, and I'm just going to take a quick look, okay? So can you just say off for me? Thank you. Okay, I'm just gonna quickly look inside your mouth. So the reason that I'm doing this is because your trigeminal nerve also lets you be able to feel inside your mouth. So sensations of touch and pain and changes in temperature inside your mouth. So I'm just seeing if I can observe any visible issues on the gums or the teeth or the tongue, the roof of the mouth, but I'm not seeing anything so far. Okay, that looks fine. Alright, so I've completely finished checking all of the sensory components of your trigeminal nerve, and everything looks great. So there's nothing to worry about with there. So we only have to check the motor component now, okay? So only the mandibular branch of your trigeminal nerve has a motor component, and it has to do with helping to move the muscles in your jaw so that you're able to eat food, swallow food, chew it, talk. So I'm going to just have you do some things with your jaw so that I can make sure that it's working properly, okay? So, can you just open and close your jaw really quick? Okay, thank you. I'm just going to look as you're doing that, just as you normally would, okay? Just looking at the muscles, okay? Alright, I'm gonna push up on your jaw and I want you to open your jaw against the resistance of my hands, okay? I'm just gonna check the strength of the muscles, okay? So just close your mouth first. Okay, I'm gonna put my hands around your jaw, okay? I want you to open your jaw, okay? Alright, just open it against the resistance, checking how strong, okay, perfect. Alright, super strong, yes, okay? So now, I want you to just clench your teeth, and I'm just gonna palpate the muscles, okay? I'm just going to, clench your teeth. Okay, perfect, thank you, that looks great. I'm just palpating the muscles in your jaw as you clench your teeth, just checking for the tone of these muscles, making sure that they feel good bulk and lean, and that I don't feel like they have lost any volume or anything like that. Making sure. Okay, have you ever experienced any time in your life or recently any issues with your jaw that you're aware of? Have you ever felt weakness in your jaw? Okay, perfect. Okay. Okay, perfect. You can unclench. I know I had you clench for a long time, sorry, but you can unclench now, okay? So, now I'm going to just have you show me an underbite. Yeah, it doesn't look very pretty, but it's okay. I won't tell anyone, okay? Just do a little underbite for me, okay? I'm just gonna look at the side of your jaw. As you do that, just keep having underbite. Okay, like a bulldog. Is it a bulldog? I think it's a bulldog. Just keep doing underbite. Okay, perfect. Okay, so now can you move your jaw from side to side? I'm just looking as you do that. Okay, just keep doing it. Okay, that's fine. So I'm gonna put my hands back on your jaw and I want you to move it side to side against resistance, okay? Alright, so I'm gonna put... It's okay, can you move it side to side? This side, okay. That side and this side. That side, okay, perfect. So I just need to do one more thing. Okay, so I'm gonna put my thumb in between your lower lip and your bottom of your chin, and I'm gonna tap it just to check if there's a reflex on your jaw. There shouldn't be, so hopefully you don't, okay? So, because if there is, I can show that there's a problem with the muscles in your jaw. So just relax your jaw. Okay, good. I'm just gonna put my thumb right here. Okay, I'm gonna start tapping. Okay, I'm just looking to make sure that there's no deviation in your jaw as you do that. Okay. Alright, perfect. I didn't see any reflex of your jaw when I did that, which is what I wanted to see, okay? Alright, so I did everything that I needed to do. I don't see any issues with your trigeminal nerve. Both the sensory component seemed to work perfectly fine, and the motor component also worked perfectly fine. So all three branches of your trigeminal nerve work wonderfully, okay? Alright, so thank you so much for coming into the trigeminal nerve room. I hope that you are enjoying your cranial nerve examination so far. Alright, so you can just go back out the doors over there and keep walking down the hallway, and you'll see the next specialist, okay? Alright, bye. I loved having you in here. Bye. Oh my goodness, please come in. Hi, come inside, don't be shy. Yes, come in here, get comfortable, okay? I am the specialist for the facial nerve, otherwise known as cranial nerve number 8. Yes, I have the best room, don't I? Oh, just say yes, yes. I know their rooms are pretty too, but mine's the best. It's okay, I won't tell them, okay? Just relax, get comfortable, okay? I'm gonna assess your 8th cranial nerve to make sure that everything is working as it should be, that there's not any problems, okay? Alright, so your facial nerve, cranial nerve number 8, has lots of different functions, okay? So we have lots of different things to test, but it'll go very fast. Oh yeah, of course. Very fast, very smooth. You can just relax, okay? So I'm gonna start. Just sit comfortably for me, okay? And I want you to rest your face just naturally. So I'm gonna start by checking for symmetry on your face, okay? Because one of the things that the facial nerve does for you is it helps control the muscles in your face. So it has a bunch of motor fibers that help you make facial expressions. So if your facial nerve is not working correctly, this can cause drooping on certain parts of your face, or it can cause you to be unable to move certain areas of your face. It's like being unable to move your forehead, so you couldn't like wrinkle your forehead. You wouldn't be able to maybe move your eyebrows. You couldn't lift your eyebrows up. Or it could cause you to not be able to control the corners of your mouth. So you wouldn't be able to really smile or frown. Or it would cause problems with eating as well. Could cause problems with drooling. Yes, it can be very detrimental, but in terms of just examining your face while you're sitting here resting it, I don't see any issues with symmetry. Of course, not everyone's face is perfectly symmetrical, but if the facial nerve was not working correctly, it would be very drastic changes in symmetry from one side to the other, and I definitely don't see anything like that. Okay, so your symmetry is fine. Let me just put this over here. Okay, so what I'm gonna do now is I'm just gonna have you make a bunch of different expressions, and I'm gonna have you first do it just naturally, so without any resistance, and then I again want you to make the same expressions, but I'm gonna do something that will cause just a little bit of resistance to see how strong the muscle is. Okay, so just to keep relaxed. It's okay. All right, so can you just smile for me? Yes, perfect. You have a beautiful smile. Okay, you can relax your mouth now. That was perfect. Okay, so can you frown for me? Perfect, perfect. Okay, so just relax your mouth again. Okay, so I'm just gonna kind of pull a bit downward on your mouth, and I want you to try to smile again, okay? So just, okay, can you smile? Perfect. Okay, now can you smile again? Okay, I want you to keep smiling. I'm gonna try to pull down on your smile, but don't let me, okay? Don't ever let someone make you frown, okay? Okay, perfect. Alright, so can you just frown again for me? Okay, I'm gonna try to make you smile, okay? Okay, keep frowning. Don't let me undo your frown. Okay, perfect. Okay, can you scrunch up your nose? Okay, I'm gonna pull down on your nose, and I want you to still try to scrunch it up, okay? Okay, I'm just gonna pull down on your nose. Scrunch your nose, scrunch your nose. Oh, perfect, absolutely wonderful. Okay, so I want you to puff out your cheeks. Yes. Perfect, perfect. Okay, so I'm gonna now take my hands, and I'm gonna press against your cheeks, and I want you to, against that resistance, to puff out your cheeks again. Okay, I'm gonna put my around. Okay, can you puff out your cheeks again? Yeah. Okay, good. Oh, perfect. Strong. Yes, your muscles are so strong. Just a few more, okay? So I want you to lift your eyebrows up really high. Perfect. Okay, I want you to wrinkle your forehead. Yeah, wrinkle. Okay, rest your forehead. Okay, I want you to wrinkle your forehead again, and I'm just gonna pull at some areas and just try to keep wrinkling, okay? Okay, so just keep wrinkling your forehead. I'm just pulling up at some areas. Okay, want you to raise your eyebrows again. I'm going to try to pull down, but don't let me, okay? Alright, so we'll lift them up. Perfect. I'm going to try to pull this eyebrow down. Okay, I'm going to try to pull your other eyebrow down. Keep lifting them up. Keep lifting them up, 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 up. Okay, wonderful. So now I want you to close your eyes as tightly as possible. Yes. Okay, I'm just going to look as you do that. Just examine this eye. Okay, then I'm going to examine the other eye. Okay. Can you try to put your eyes as wide as possible? I'm just going to examine. Make sure that your muscles are working great. Okay, perfect. You can rest your eyes normally, okay? So I'm going to have you close your eyes tightly again, and I want you to resist as I try to pull them open. So try to keep them shut, okay? Alright, perfect. So close them as tightly as possible. Just okay, I'm gonna try to open them. Keep them shut, keep them shut, keep them shut. Alright, perfect. Okay, I want you to open your eyes wide, and I'm gonna try to shut them. I'm gonna pull down. Don't let me shut them though, okay? Alright, perfect. So open your eyes. Okay, I'm gonna try to shut your eyes. Shut your eyes, shut your eyes. Don't let me. Okay, perfect. Alright. So, I didn't see any problems with the symmetry before, and then with this test, I didn't see any issues with any of your muscles, okay? They all look strong, and so all of your motor fibers are working perfectly, okay? So another thing that your facial nerve helps you with is with some parasympathetic fibers, okay? So this means that it helps your mouth produce enough saliva, and it also helps you cry. So I'm not gonna test to see if you can cry, don't worry. But have you ever had any issues producing tears in your eyes? Okay, and can you just open your mouth really quick? Yes, I'm just gonna take a look. Just observe really quickly. I'm just looking at your saliva levels. Okay, does your mouth, you can close your mouth. Does it ever feel excessively dry? Okay, so the last thing that I need to check is your facial nerve. Also has sensory fibers. And so the interior 2/3 of your tongue, it helps with the taste. So there's a few other cranial nerves that also deal with taste, but I'm gonna test your taste here, and then I'll just tell the other ladies that if your taste is fine, I'll just let them know so they won't have to test it again, okay? So you will just have your taste tested here, and then you'll be done with that, okay? Alright, so I'm gonna cover your eyes, and I'm just gonna slip a little flat sheet into your mouth, and I have 3 different flavors. I'm just gonna see if you can taste them, okay? Alright, so I'm going to take this. Alright, I'm gonna cover your eyes, so just stay off for me. I'm just gonna place it on your tongue, and then I'll tell you when to close. Taste it, okay? Cover. Okay, stay off for me. Just gonna slip it in your mouth. Okay, close your mouth. Okay, I'm gonna open your eyes, take my gloves off. What does it taste like? Perfect. Yeah, that was great. Okay, good. Let me just do 2 more times just to be safe. Okay, just to be safe. So I'm gonna take another one. Okay, I'm gonna close my hand over your eyes again. So close your eyes. I'm gonna put my hands over your eyes again. Okay, open your mouth. Open your mouth. I'm just gonna slip it inside. Say ah. Okay. Close your mouth. What does it taste like? Wonderful. Okay, good. So we just have one more thing, okay? It just makes me happy that you're doing so well. Yes. I don't want you to have any problems. So we just have one more thing, and then you'll be out of the clear with the facial nerve, okay? So I'm just gonna take this very last one. Okay. I'm gonna cover your eyes again, okay? Open your mouth. Open, open, open. Say, oh, I'm just gonna place this inside your mouth on top of your tongue. Okay, close your mouth, close your mouth. Okay, taste it. Okay, what does it taste like? Perfect. Yes. Yes, that's absolutely wonderful. Oh my gosh, okay, well then you passed everything. So all of your motor fibers are working, the sensory fibers are working, the parasympathetic fibers, everything's working perfectly. Yes, so your cranial nerve number 8 is wonderful, passed with flying colors. There's not a single issue, okay? So you're done in here, so you can just go out into the hallway and just keep going down the hallway, and you'll see the next room so that you can continue with the cranial nerve examination, okay? Alright, I loved having you in here, okay? Bye, bye, bye. The door is open. Hi, welcome to the Vestibulocochlear Nerve room. You can come inside, and if you don't mind, I would like for you to stay standing this time. I know it's a bit different, typically set for the other specialists, but if you don't mind, just stay standing for my room, okay? You won't have to stand for too long because I don't have that many tests, alright? Okay, so I'm the specialist for the vestibulocochlear room, okay? So the vestibulocochlear nerve has 2 components, alright? The vestibular nerve, which I will be testing, and then the other nerve I need to test is your cochlear nerve, hence the name vestibulocochlear nerve, okay? Alright, so I'm going to start by testing your cochlear nerve, and your cochlear nerve is responsible for ensuring that you have proper hearing in both of your ears, okay? So I'm first just going to take a little peek inside both of your ears, just really quick with my little light, okay, and microscope. So you can just keep your head straight, okay? I'm just gonna go back to this here, okay, and I'm just looking inside. I'm just seeing if there's any blockage anywhere. Just make sure that your ear is clean. Okay, your cochlear nerve is inside your ear. So I'm just making sure that the outer and middle ear doesn't have any visible issues. Okay, and just okay, I think that looks fine. Okay. I didn't see any problems inside of your ear, so I'm just going to do a quick little hearing test. It'll just be very quick, okay? Because I'm sure if you had issues with your hearing, you probably would have noticed, okay? So I'm just going to make some sounds in one ear, and then I'm going to whisper into the other ear and just tell me what you hear, okay? Alright, so I'm going to go to this ear, okay? Sleep, 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 sleep. Alright, what word did you hear me repeating? Perfect. Okay, I'm going to go to the other ear, okay? Relax, 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 relax. Okay. What word did you hear me repeating? Perfect. Okay. That's all I need to do. Yeah, that's fine. Okay. So what I'm going to do now is I'm going to take a tuning fork and I'm going to place it behind your ear, and you're going to hear the vibrating sound, and I want you to tell me when you can no longer hear it, okay? And then when you can no longer hear it, I'm going to remove it from behind your ear, and I'm going to place it in front of the opening of your ear, and I want you to tell me if you can still hear the ringing again. Hopefully you should be able to, okay? Alright, so I'm gonna strike it. I'm gonna put it behind your ear, okay? Can you hear the ringing? hear it? Okay. Now I'm gonna place it in front of your ear. Can you hear it again? Okay, wonderful. Good. Okay, I'm gonna do it to your other ear. I'm gonna strike it. I'm gonna place it behind your ear. Alright, can you hear that? Okay, tell me when you can no longer hear it. Can no longer hear it? Okay. Placing it in front of your ear. Can you hear it still again? Okay, wonderful. Good. Okay. Now I'm going to take the tuning fork. I'm going to strike it. I'm going to place it up on your forehead. Okay. Now I want you to tell me if you can hear the ringing, and it's equal on both sides of your ears. Like, does it sound the same in both ears? Yes, okay. Good. Then that's all I need to do with the tuning fork, and that's all I need to do to check your cochlear nerve. And you passed each test, so I don't think that you have any problems with your cochlear nerve in either ear, okay? Alright, so now I'm going to move on to the second part of the vestibulocochlear nerve, which is your vestibular nerve, alright? So your vestibular nerve is important to ensure that you have proper balance, okay? So it helps give information about your body's position, helps you maintain good posture, and it helps your body know where your head is. So it helps you understand if you are tilting your head, rotating your head. It's just a very important nerve that helps process information to help ensure that you can maintain good balance and good equilibrium, okay? So I'm going to just check your posture really quick, alright? That's why I had you stay standing, okay? So just stand as you normally would, alright? I'm gonna look. Alright, back at your... Okay, I'm just visually inspecting it first. Okay. Look. Your shoulders in the front. Look at the way that you carry your head. Okay. I'm gonna touch the back of your neck and look at your neck and back at the top. Okay, I'm gonna look at this side. Look at your neck and back to the top. Okay. Alright. So what I'm gonna do now is I'm going to cover your eyes, and I'm going to have you try to stay as still as possible for about 3 seconds while I have your eyes covered, okay? So just stand normally, have your feet flat on the ground, like that, perfect. Have your arms rested at your sides, okay? So I'm going to cover your eyes and count to 3, alright? And try to stay still, okay? Alright, so I'm going to cover your eyes, okay? I'm going to go 3, 2, 1. Okay, good. I'm going to do it again. I'm going to cover your eyes. Okay, make sure that you can't see. Okay, 3, 2, 1. Okay, I'm going to do one more time, okay? I'm going to cover your eyes. Okay, 3, 2, 1. Okay. So now I want you to put your arms out to your side, so you can keep your feet planted normally on the ground, and then lift your arms, just out to this side, just like this. Okay, and I want you to try to stay still and keep your arms in that position. I'm going to cover your eyes again, okay? This one's a little harder, but I'm sure that you'll do perfect, okay? Alright, so I'm going to cover your eyes. Alright, 3, 2, 1. Okay, good job. I'm going to do it one more time, okay? Keep your arms out. I'm going to cover your eyes. 3, 2, 1. Okay. Wonderful, alright? So just when few last things, okay? Could you lift one leg up? Could you stand on one leg? 3, 2, 1. Okay, good. Could you try to do the other leg? I'll put my arms in case you fall. Don't worry. I won't let you fall. Okay, I'd catch you. Alright. 3, 2, 1. Okay, good. Could you try putting one leg behind you, like have your legs apart like this? Just place one leg behind you. Okay, 3, 2, 1. Okay, could you put the other leg behind you? So one leg's in front, kind of like a pyramid with your legs. Yes. Alright, 3, 2, 1. Okay, you could stand normally, alright? Have you ever experienced any dizziness before, any difficulty walking, difficulty maintaining a good posture? Okay, then I'm done with everything that I need to do to test your vestibular nerve, and both your vestibular nerve and your cochlear nerve in both ears works fine. I don't see any problems, alright? So you passed this room, okay? Congratulations. So you can just head on back out the doors and continue down the hall. I loved having you in here, okay? I hope that you enjoy the rest of your cranial nerve examination, alright? Okay. Bye-bye.
Oh, you can open the door and come in.
Hi, welcome to my room. Just come in and sit down and get comfortable, okay? So I specialize in 3 different cranial nerves: your glossopharyngeal nerve, your vagus nerve, and your hypoglossal nerve. So cranial nerves 9, 10, and 12, alright? So the reason that I specialize in 3 of them is because all 3 of these cranial nerves work together to help the movements of your tongue and your throat. So a lot of the tests that I'm going to do help me see for all 3 of these nerves if they work correctly, okay? Alright, so what I'm gonna do is I'm just going to start by inspecting inside of your mouth, okay? So if you don't mind, could you just say "ah" for me? Thank you. I'm just going to start looking with my hands. None of this is going to be uncomfortable at all, okay? But if there is any pain anywhere, please let me know. So I'm just examining your tongue really quick. Okay, I'm just looking to see if there's any loss in symmetry on your tongue, or if there is any weakness in the muscles of your tongue that would cause one of areas of your tongue to kind of be lopsided, to not look symmetric with the other side. Okay, I'm gonna take this light. Okay, can you just relax your mouth really quick? Okay, alright, open it again. Thank you. So if any of these cranial nerves aren't working correctly, it can cause weakness in the muscles of your tongue, which means that you could have difficulties with speaking correctly, not being able to say words correctly, difficulties with chewing your food, swallowing. I don't see any issues with what I'm looking at. I think that your tongue looks quite normal. I don't see anything on the appearance of the tongue that looks concerning. Okay, let me take a stick. Okay, just close your mouth, relax it really quick. Just relax. Okay. Open your mouth. Perfect. I'm just gonna look with the stick really quick, just without my light first. Just lifting the tongue a little bit again. Just the back of your mouth a little bit. Okay. I'm gonna use my light and the stick this time, okay? none of this has been uncomfortable so far, correct? Okay, perfect. Just keep having your tongue open, okay? I'm almost done. I promise you're doing really good so far, okay? Just double checking. I just really want to make sure that there's no problems. I don't want to miss anything. Okay, perfect. I didn't see any issues with the appearance. Okay. If you don't mind, could you open your mouth again? I'm just going to take this stick and I'm just going to poke certain areas of your tongue. See how your tongue reacts, and also just tell me if you feel it, okay? So just to say, open your mouth again. Okay, thank you. I'm just going to poke there, okay? I'm going to poke right there. Okay, I'm going to poke there. Okay, I'm going to poke here at the tip. Okay, I'm going to poke a little bit in the back. Alright, I'm going to poke there. Okay, and I'm going to poke there. Okay, I'm going to dispose of the stick real quick. Alright, so I'm going to look at your tongue movement now, okay? So if you don't mind, can you just stick your tongue out? Yes, okay. Just looking really quick at that. Okay, perfect. Alright, perfect. Okay, could you open your mouth and put the tongue to the roof of your mouth? Yes, okay, wonderful. That looks great. You're doing wonderful. Okay. Alright, perfect. Could you put your tongue to the side? Okay, could you put it to the other side as well? Okay, could you slowly go back and forth? Okay, good. Just making sure that your tongue muscles are strong, okay? Can you go in and out with your tongue slowly? Okay, could you do it rapidly? Okay, can you put your tongue up and down slowly? Okay, can you do it rapidly? Yes, thank you. Alright, can you push it to your cheek? Okay, could you push it to your other cheek? Okay, can you go back and forth slowly first? Yes, thank you. Okay, could you do it rapidly? Perfect, thank you. Okay, keep doing it. Okay, perfect. So the last thing I need to do to test the strength of your tongue is I'm gonna have you push against resistance, okay? So I'm going to put my hands on your cheeks and I want you to push your tongue out against my hand, okay? Alright, so just start with your left cheek. Can you push your tongue to the left? Yes, good. Okay, strong. Okay, perfect. That was really good. Okay, now I'm going to do it on your other cheek. So can you take your tongue and push it against your right cheek? Yes, push against your right cheek. Good, push. Alright, wonderful. Yes, that was absolutely perfect, okay? So now I'm going to have you do some movements that you do normally every day, okay? So I'm going to ask you if you could quickly just yawn for me. Yeah, and I'm just going to palpate the muscles of your neck while you're doing that, okay? And then just a little bit on your jaw. So can you just yawn for me? Really big yawn. Yes. Okay. Could you just yawn again for me? Just feel like yawn a few times, alright? Just palpating your neck. I'm just checking the muscles in your neck. Okay, and up and into your jaw. Making sure that it's all strong. There's not any weakness. Okay, alright. That's good. Could you cough for me? Yes, okay, just cough. Okay, cough. Okay, could you cough again? Okay. Could you cough one more time? Yes, okay. Alright, that's perfect. could you swallow for me? Just act like you're swallowing something, like food or drink, okay? Okay, could you swallow again? Right. Okay, could you act like you're chewing something? Your jaw a little bit. Okay, keep chewing. You're doing great. Okay, I'm gonna go down to your neck and test the neck. Keep chewing. All right. Okay, perfect. So I didn't see any problems with the muscles in your tongue or the muscles in your throat, okay? So your glossopharyngeal nerve also has a sensory function to help the posterior 1/3 of your tongue be able to taste, but the specialist for the facial nerve told me that she did your taste test and everything's fine. So I don't have to test your taste again, okay? Alright, so the last thing that I need to do though is regarding your vagus nerve, okay? So your vagus nerve also has a lot of other functions than just helping the muscles in your neck and your mouth, because it's the longest nerve in your cranial nerves, and so it goes down into your abdomen and it actually connects to a lot of your internal organs. So it's really vital in making sure that a lot of your internal organs can function properly. So I just need to do a few things to make sure everything's running correctly, okay? Alright, so if you don't mind, I'm just going to start palpating your abdomen, just looking for any discomfort or pain. So if it hurts anywhere, please let me know, okay? Alright, so I'm just going to start palpating your abdomen again. Just let me know if there's any discomfort. So if your vagus nerve is not working properly, it can cause issues with your breathing, with your heart rate, blood pressure. It can have problems with your digestion. So it's a very, very important cranial nerve. I mean, all of your cranial nerves are important, but this one's extra important. But don't tell any of the other specialists I said that. They will not like that. They'll be very offended I said that, but it's fine if you just don't say anything, okay? So I'm just gonna keep palpating. None of this is uncomfortable. Okay, that's great. Alright. Okay, then if you don't mind, I'm going to just quickly listen to your heartbeat and your lungs, okay? So if your vagus nerve's working properly, then you shouldn't have any problems with your heart rate or your lungs, okay? So can you just breathe normally for me? Just checking your heart first, making sure that it's beating properly. Okay, it's not too fast. Okay, it sounds normal. Okay. I'm gonna go to your lungs, okay? Could you take a deep breath for me? Okay. Could you take a deep breath for me? Okay, I'm gonna go behind you. Could you take a deep breath for me? Okay, just hearing what it sounds like, making sure that it sounds good. Okay, I think it sounds good. Okay, perfect. I'm just gonna listen to the lower part of your abdomen real quick. Just breathe normally, okay? Okay. That's good. I didn't hear any problems, which is wonderful. Alright, so let me put this up. Okay. If you don't mind, I'm just gonna check your heart rate really quick. So I'm just gonna put my fingers right here on your neck, okay? And just breathe normally, okay? I'm just gonna count how many times that your heart is beating in a certain interval of time to make sure that it's not too low or too high. Okay, just keep breathing normally. I'm just counting. Okay. let me get my blood pressure check. Okay, so I'm gonna check your blood pressure really quick, okay? Hopefully your blood pressure is normal. Your vagus nerve is vital in having a proper blood pressure. So just stick out your arm. I'm just gonna put this over your arm really quick. Okay, and this is the last thing I need to do, so you are almost done, okay? Alright, so just breathe normally, sit comfortably, be relaxed. I'm starting it right now, okay? It's not painful at all. There's not going to be any discomfort. You can just stay at ease, okay? And just 5, 4, 3, 2, 1. Okay, let me check. Alright, perfect. Your blood pressure is great, okay? So let me put this away. Okay, well, all of your cranial nerves number 9, 10, and 12 are working absolutely wonderfully. Yes, there's not any problems, okay? Which is great to hear. So you did absolutely wonderful in this room. And once you leave, you'll only have one more room to do. So you are almost done with your cranial nerve exam, okay? Well, I'm so happy that you came in here. I had a pleasure serving you, okay? Alright, I hope to see you again someday, okay? But hopefully for a good reason. Just for a checkup, not because there's something wrong, of course, okay? Alright, bye-bye. Oh, come in. Hello, welcome to your final cranial nerve room, cranial nerve number 11. I am the specialist for the cranial nerve number 11, otherwise known as the accessory nerve. Alright, so I'm going to be doing your examination for the accessory nerve, and then once I finish, you'll be completely done with your cranial nerve examination, okay? Alright, so the accessory nerve helps two very important muscles of your upper body function. Your sternocleidomastoid muscle, which is on either side of your neck, and your trapezius, which is in the back, upper back, and then up to your shoulders, okay? So I'm going to be seeing if there's any problems with either of these two muscles, because issues with these muscles can show that you have an issue with your accessory nerve, okay? So, if you don't mind, I'm just gonna have you stand straight with your shoulders back. Just stand as you normally would, okay? I'm just going to check your posture really quick, and I'm just gonna quickly palpate these two muscles while you just stand normally. Just checking either side of your neck. Check over here. If there's any issues with these muscles, or specifically with the accessory nerve, it can cause weakness in these two muscles, either in both or in just one, or it can cause paralysis of these muscles or partial paralysis. I'm gonna start checking your shoulders real quick. I'm just gonna palpate it, okay? And also the back of your neck, okay? I'm gonna start with your shoulders. Just again, stand as you normally would, okay? So I'm looking for signs of weakness with these muscles, which could include an asymmetrical neckline, so drooping of one of your shoulders, or it can cause one of your, I'm going to go to the back of your neck and upper back, okay? It can cause your shoulder blades, or one of your shoulder blades specifically, to protrude from your back abnormally, or have lateral displacement along your back. Okay. tone as I palpate as well. So just hitting it over. Okay. So now I'm going to have you do some movements that will help me see the strength of these two muscles. Okay, so the first muscle I'm going to focus on is your sternocleidomastoid muscle, which again is on either side of your neck. Alright? So I want you to tilt your head back for me, okay? Just do it slowly. I'm just gonna feel the muscle that be palpating to check as you do this, okay? Can you bring your head back to center and then bring your head forward? Just tilt your head forward. Thank you. Great. Tilting. Okay. I can bring your head back normally. Thank you. So I want you to tilt your head to the side. Okay. Okay, you can bring your head back to center. Thank you. Could you tilt your head to the other side? Just gonna keep feeling the muscle as you do this. Okay. Okay. Can you bring your head back to center? Okay, and you haven't felt any pain while doing any of these movements, correct? Okay, if at any time you do, please let me know. So now I just want you to rotate your head to one side. Okay, can you feel? Okay, could you rotate your head to the other side? Thank you. Just feeling along this side of the neck as you do that. Okay, could you bring your head back to center? Okay, so just to make sure that the strength of these muscles is okay, I'm just going to have you turn your head against my hand, so just against resistance, okay? So I want you to turn your head into my hand, okay? So I'm going to resist you turning and just keep, okay? So just try to turn your head. Okay, just making sure that you... Okay, perfect. I'm going to do it to the other side. So I'm going to put my hand here. Alright, I want you to press and push against my hand. Keep turning, keep turning. Okay. Perfect. Okay, your muscle seems really strong, alright? So now I'm going to put my hand on your forehead and kind of push you back a bit. But I want you to resist that and try to still tilt your head forward, okay? Alright, so I'm gonna put my... Okay, I want you to tilt your head forward. Forward, forward, forward. Forward. Okay, good. I'm going to put my hands on the back of your head and I'm going to push forward and I want you to try to tilt back, okay? So I'm just going to put my hands, okay. Alright, I want you to try to tilt your head back as I kind of push forward a bit. Okay, wonderful. So now I'm going to move on to your trapezius muscle. I didn't see any issues with your sternocleidomastoid muscle, so that's all good, okay? You don't have anything to be concerned about with that muscle. So I'm going to check your trapezius muscle next. So I'm going to mainly focus on your shoulders, okay? So can you just shrug your shoulders up and down? Okay, I'm just going to look at it as you do that really quick, just to visually examine. Okay, I'm gonna keep doing that. I'm gonna smooth my hand over the shoulder. Okay, I'm gonna smooth my hand over your shoulders. You do it. Okay, palpate as you do it. Okay, now I'm gonna press down, and I want you to still try to shrug your shoulders just to test the strength a bit more. Okay. Rest my my hands on your shoulders. Okay, can you just shrug up against the resistance of my hands? Perfect, perfect. Okay, good. So next I'm going to have you do some arm movements, okay? So I'm going to have you take this arm, okay? And I just want you to put it laterally to your side. Okay, I'm just examining the muscle with my eyes only first. Okay, I'm gonna smooth my hand down. Or make you do this. Okay, I'm gonna have you lift your arm all the way above your head this time. I'm gonna lift it up. Okay. Is any of this painful when I have it lifted up? Okay, good. Okay, I'm just gonna rotate your arm a bit. Is any of this painful? Okay. Have you put your arm back down? Okay, so I'm gonna have you take this arm and put it again laterally to your side. So just place it. Okay, I'm just gonna examine this visually first. Okay, I'm gonna smooth my hand along. Make sure okay, I'm gonna have you put your arm up above your head like this, okay? Does any of that hurt? Okay, just feeling. Okay, I'm gonna have you rotate your arm a little bit. Just looking at the trapezius muscle. You can do that. Okay, you can put your arm back down. Okay. Now, can you just turn around for me really quickly? Thank you. I'm just checking your upper back, making sure that it's all okay. Just ensuring the trapezius muscle is working perfectly fine. Okay, your shoulder blades, make sure that they're where they need to be. I don't see any symmetry, any problems with symmetry between the two. Your shoulder line from the back, again, just like in the front, I didn't see any problems with symmetry, and I don't in the back either. Okay, you can turn back around and face me. Alright, perfect. So, both of your muscles work perfectly fine, thus your accessory nerve, there's no problems with it, okay? So, you finished your examination in here, and thus you have completely finished your cranial nerve exam. Okay? Alright, so I'm very happy that you came in here and saw me. I loved doing your accessory nerve examination, and I hope that you enjoyed doing your cranial nerve exam. So you can just go out of the door and go back to the front, and then she'll check you out, okay?